As Nigeria continues to post more than 1,000 infections per day for the past 1 week, Vice President Professor Yemi Osinbajo has been consulting with doctors and scientists in the country with a view to exploring a means of breaking the deadly flow while giving a new direction to the battle against COVID-19 pandemic. Well, joining us now to offer her professional expertise is Dr Rukevwe Ugwumba, a family health expert and consultant to the Senate Committee on Health. As we hinted earlier, she will also discuss Nigeria's efforts at vaccine procurement and how families can begin to deal with the mental stress being unleashed by the COVID-19 pandemic. Welcome to the program, Dr. Rukevwe.
Hello, good morning.
Good morning.
Good morning, Doctor. Good to have you again on the morning show. Well, two issues we've been talking about in the last 2 days on this program. First is the meeting between the Vice President and a group of Nigerian professors who are looking into the possibility of ivermectin as a prophylactic and also a cure, a treatment option for COVID-19. And the Nigerian government is providing support for them. Their initial report, we're told, is being looked at by the WHO. Do you think Nigeria needs to do a lot more in terms of encouraging local researchers? The second issue that we have had to focus on this morning has to do with the distribution of vaccines, the allocation from the COVAX facility. A list has been published out there, and we seem to be surprised that that distribution list is based not on data, not on prevalence rates, but maybe on some rule of thumb or some whims and caprices, with states that have high prevalence rates getting much lower than states with low prevalence rates. Would like you to please comment on these two: support for research and then how the vaccines should be distributed.
Yes, thanks again for having me on. First of all, yes, there's been quite a lot of talk about ivermectin. It's a very known drug, very safe, been around for a very, very long time, and has been used to treat different parasitic infections, and very well researched for leishmaniasis and some helminthic worms. Now, there's evidence, and it's growing, that ivermectin actually does stop the spread of COVID and helps the convalescence of people already infected. It's a very cheap drug. It's a 3-day treatment, and so it's definitely worth trying because the side effects are very low. Yes, we should be doing more. We shouldn't just be following what other doctors everywhere in the world are doing. Nigerians have very brilliant doctors, and we do have labs, and we can do our own testing, and I haven't really seen much data from our own researchers. I'm not sure how well funded the research into treatment options for COVID have been supported by the federal government. I mean, there's also talk about the BCG vaccine, which we normally give at birth for tuberculosis, whether it was protective against COVID. I'm not sure what Nigeria is doing regarding that. I know the WHO is also looking into that. So for sure, there are other drugs. I mean, we've heard of the hydroxychloroquine, which is very controversial, which they say helps, and so many other combinations of different things we know can penetrate the membrane of the vaccine, of the virus. I'm talking about vitamin D3, which actually acts as a hormone. So people who are low in vitamin D3, you would think that with a lot of sunshine here, that we would be getting lots of vitamin D, but actually most people are indoors, and so vitamin D is quite low. And so we know that people that are deficient in vitamin D are more susceptible to getting the COVID virus. So again, there are many different things that can be done to reduce your getting infected, having been exposed to COVID. And how do you know if you're exposed? You just don't know, because there's so many asymptomatic carriers. That's why it's rising sharply, and we know that the virus is mutated. In fact, Nigeria is one of the countries with the UK and South Africa that the CDC are looking into the strains, the new strains. There's thousands of new strains of the COVID mutations. But these particular strains look to be more infectious. And we know that more infectious disease is more deadly than even more deadly virus. Let me explain. So a virus that mutated, that is easily transmitted, even though it's not killing more people because of the mutation, but getting spread more easily, will kill more people than a more deadly strain. So we are more afraid of a more infectious strain than a more deadly strain. So we really need to be careful on how we transmitting this virus. And again, viruses will always mutate because they want to survive. And so these are the new problems that this COVID is presenting. It's trying to stay here, and we are encouraging it by moving so much. That's why there's new lockdowns, new lockdown mandates in the United Kingdom. In fact, today in Canada, where I live, Ontario government has done a stage 5 lockdown, very, very severe lockdown, and there will be penalties, including it's now a criminal offense to break it, not just a fine, and it's going to last for another 28 days. So, we have to do things to make people know that this virus is spreading, it's getting more infectious, and more people will die. Now, the second thing you asked me about the distribution, how they decided that, again, it's like doing politics, where politics has no business. This is a science-based decision-making that must be done, not political. You understand? So you're telling me that Lagos State, for example, that is so densely populated, will get less vaccines than Kano, whereas we know there's over, like you said, over 1,000 infections a day, and Lagos is actually where the infection is concentrated. So how on earth would we be giving the North more vaccines than the densely populated area where the vaccine is causing issues? So bottom line is, we really need to stop doing politics where politics has no business. We need to really ask the scientists, the doctors, and the researchers to help us to distribute this vaccine so that we can stop the spread. Now, there's another crazy thing that I just noticed today, that the Nigerian government gave until 19th of January for people to link their NIN to their mobile numbers and all that. And there's introducing huge crowds in places where there should be a total lockdown, where other countries are saying, don't go if you must not go. So only essential work that you should do. And in the midst of new strains and more, the second wave, we're getting worried. We're putting crazy deadlines and more pressure on Nigerians who are already stressed to the max with this virus, and nobody knows what the true numbers are, because a lot of testing has not still been done. And we know that the way to stop this COVID-19 is to vaccinate people and to stop the spread of the virus. And we haven't done either. And in fact, we're encouraging the spread because we are asking people to go and queue if you just go to any of those places where they're doing these registrations, you'll be really appalled. There's nothing like social distancing. Many people are not wearing the mask, and is a recipe for disaster. So yes, the government is doing very little to help Nigerians, neither with the distribution of the vaccine or all these crazy new deadlines. I was wondering, what happened to the BVN? What is this new NIN? So again, it's the wrong time, even if there's something important, somebody's office came up with this. This is a pandemic that's killing people, and Nigerians are now feeling the brunt of it. Just recently, 5 people died because they attended a party, and some of them were even doctors. And these doctors, some of them professors. So there's nobody immune to this virus, not your status, not your money, not your socioeconomic situations. We just need to stop going out and mixing unnecessarily, because that's how we get the virus. And the government hasn't shown me that they're really serious about tackling this, not with their vaccine distribution list, neither with all these new protocols to get registration for things that are not even important right now when we're trying to save lives. That's my take on it.
And thank you very much, Dr. Rukevwe. I hate to be the bearer of bad news, but just in case you missed the memo, yesterday, even if you had a NIM generated from the BVN, you would still need to go to a NIMSI center. So just add that to your already piling worries.
19th of January.
Yes.
Can you imagine that?
It's unbelievable. But my question to you, I mean, you've referred to lockdowns and stringent measures in other parts of the world. But the argument has been that, for economic purposes, we cannot simply afford another lockdown. Are you advocating that the Nigerian government, imposes another lockdown? And what exactly should that be like? You're also the health consultant to the Senate Committee on Health. What is the...
Was.
Oh, was.
Yes.
Okay, great. But what should be the conversation around vaccine distribution? This is just 100,000 doses. Is there any excuse that is tenable for the supervising National Primary Healthcare Development Agency to distribute across the 36 states plus the FCT in this manner? What exactly should be the sharing formula? Yes, we talk about prevalence, but every state has recorded a case. So what should that formula really truly be?
Okay, they should use very simple scientific data, hotspots. Okay, we know that from the hotspots, in fact, that's what we're doing in Canada. You will target contact tracing and those people that are vulnerable. So in general, you want to target elderly people and people that have immunocompromised situations like diabetes and kidney problems and things like that. But most importantly, this is a very specific pandemic for COVID. And we know the cases are imported and the cases, the virus doesn't move. People move the virus. And so you have to go to those places where there are more cases. It doesn't make any sense to do it any other way. I just don't understand it. And again, the NCDC really need to explain how they came up with this distribution list, because it makes absolutely no sense. Like I said, they're doing politics where politics has absolutely no business being there. In the end, many Nigerians will die because of this shoddy approach to vaccine distribution. Regarding, what was the other question again?
Lockdowns.
The lockdown, yes, it's absolutely correct that we cannot afford lockdowns in the way that we do it elsewhere, because there is substitution for income. So when they ask you to stay at home in Toronto, someone is going to give you some money every month. And it's not, you don't have to go anywhere. You just have to register with your SIN number, which is your social insurance number, and you will get the money if you have been working. And even as it's prolonging, it's hard for the government to sustain. So they're going to match your previous income. And those people who don't have employment go on ER. Those who have employment go on employment insurance, and those who don't have go on unemployment insurance. Bottom line is, everybody stays at home and gets some money in the bank to be able to do things. Now in Nigeria, we saw what happened with the distribution of, COVID relief packs, which was also politicized, which doesn't make any sense. And of course, people didn't get any money. And many Nigerians don't even have a bank account. So they're selling things, selling pets, doing petty trading, selling, hawking on the road. How are those people going to stay at home and feed their families? Some people make as little as 1,000 naira a day profit, and that's all they rely on. That's less than 30,000 naira a month. Now, I heard the government said 30,000 people will no longer be subject to taxes. Regardless, they don't even have the money in the first place. You're talking about taxes. Yes, we can do a lockdown, but we can target the places that are hotspots and do some more palliative measures, to make sure that people are comfortable not moving around.
Okay, Dr. Rukevwe, we'll go on a quick break now. We'll come back and we'll talk some more. Right, we still have Dr. Rukevwe Ugwumba, family health expert and former consultant, actually said that to the Senate Committee on Health. So, Dr. Rukevwe, all the things you were saying about Canada was like music to my ears. Maybe probably when we share the next palliative, we'll use the need numbers to help secure that, because if the SIN numbers were used, social insurance numbers were used in Canada, maybe we'll use the need national identification numbers to share all of that. But that aside, I want to talk about schools. Schools are to resume on the 18th of January. There's been argument back and forth. Now they say, tentative date, if anything happens, we'll change it. Some people are beginning to push a report done by WHO that says, oh, schools are not super spreader locations and things like that. So schools can get back on. But the universities are saying we can't go back. A lot of people, in fact, there have been allegations that students say they're going to beat up, some people in the university system if school resume at around that period. What's your take on all of this school resumption? What should we be doing as an expert?
First of all, we haven't got the real answer to this COVID, means vaccinations, okay? We know that if you get the virus, you can get immunity for it. How long-lasting is immunity, we don't know. We know that how you react when you get the virus is also unpredictable. Some people are fine, some people mild, some people are very severe. Many people die. And so we cannot afford to allow the virus to give us the herd immunity that we're looking for. So since we have not handled and tackled it, what is this urgency for education if your child goes to school and dies? One person's child. So what's the cost of a life? For one, it doesn't make any sense that we are rushing back to bringing people from various parts of the country and order them. When we know children don't necessarily, even young adults, don't necessarily follow rules as we make them because they don't understand the severity and importance of the social distancing, the using of masks and things like that. So why would you put people at risk? You haven't vaccinated them. We don't know whether you're going to, we're still watching the ivermectin. So even how long are you going to give the prophylactic if you want to even say, okay, everyone go back, we're going to give you prophylaxis. We can't give you drugs every day for the rest of the pandemic. So I don't see any sense in reopening schools because it's going to be super spreaders. And like I said, even if everyone gets it and just one person dies and that person is your child, how are you going to feel about that? So for my take, do the lockdowns. Just watch what's going on around all over the world. People are dying. Hundreds of thousands of people have died. Millions of people have died. And we know that these new strains are getting more infectious, means they're spreading more easily. And so we have to do even more stringent measures. Certainly, reopening schools, I don't think should be happening for at least another 28 days, because that's what is the trend over the world. So that's my take on that. What was the other question?
Right, so that was pretty much it no, the other question, I was just being cheeky. I said probably maybe the NIN number will be used to share the next palliative. I was just being cheeky, don't mind.
We can do the NIN, but we don't have to do it in person, like the other commentator said. Why are we going to offices? Everything is virtually done online now, virtual, because we don't want people to gather, and Nigerians really usually don't know how to queue properly. How much more when there's a deadline involved. So it's like, it's crazy. It's like you want people to spread this virus. So they will congregate, gather in one office, then go back home to their elderly people who are vulnerable. Makes no sense to me. Yes, we need a NIN number. Can we do it virtually? Can we, when it's safe to do so, go and do it? And how many offices are available for this? So none of it makes any sense. And if they want to use that to be able to give us, what's it called, COVID money, there are other ways to do it. You already have our BVN. Use that until we can sort this out. I really wanted to talk about mental health. I'm not sure how much time I've gotten left, but the severity of the stress from money, loss of income, severely affects mental health. And we've seen the rates of suicide actually increase sharply, even all around Nigeria. And one of the things that really bothers me is how we are not connecting the dots, and how this usual social system that we have, which is not a formal government system where relatives help each other, people generally just chip in. A lot of people give out palliatives every month for various to relatives. People can't even do that now because they've lost their income. And so how does the system work? So why are we not looking at addressing things properly in Nigeria? Again, I used to be in government, so it would be a bit ironic for me to say so, but it isn't. Government is too big, it's too large. We have 200 SSAs to some offices. Doing what? I don't know. There's lots of duplication of effort. You understand? These huge sums of money, even in the civil service, For me, there's huge wastage in the way we even do business, having paper files when things can be done electronically. Government should look at reforming to save money, not just asking people. I'm even hearing the other day that they want to take people's monies in dorm accounts and accounts that have not been operated for 6 years and pull that money out so government can use that because it's billions of naira. But how dare you, though? That's not your money. And you're wasting, you're not talking about how to tighten your own belt. You're going to look at people's money. You don't know where these people are. And if they haven't given you access to it, the deal is with the person and the bank, not with the bank and the government. So how do you put a middleman to my money? And if I didn't come forward since because I was given inheritance I wasn't aware of and I just found out about it when I needed the red tape to get it because you have taken my money to the government. Again, I don't understand how we do things in Nigeria. Very lopsided, if you ask me. Everybody has changed due to COVID-19. Why aren't we changing? People are realizing they don't need that huge office space. You can do things virtually. Many people can work, different times of the day. You don't even have to do a 9 to 5 as long as you do your scheduled hours. You can be with your kids in the day doing online schooling and then at night logging into the office because you don't have to go in. Why aren't we doing that? Why are we not innovating and why is government still so large and expensive? So for me, we can save money by tackling how we run government in Nigeria and use that money to help people. Let the money not be just trickled down. Let the money start from the bottom. Let people be empowered at the grassroots. That way, lots of pain will go. Now, like I talk about the mental health issues, it's depression, isn't it? Depression leads to suicide. We don't have facilities even to treat simple malaria. There's no access to healthcare, much less mental health care. With all the stigma where government is not really doing anything for awareness. Now it's still a taboo that if you're mad or if you're acting crazy, it's witchcraft or someone cursed you. It's actually a real organic problem, as real as hypertension, and it shouldn't be stigmatized at all. And there's real permanent treatment for it. So, looking for a wife, say there's madness in the family, so those people are mad. There's no such a thing. Mental illness, sometimes like schizophrenia, does run in families, but there's treatment for it. And it shouldn't, what's it called, prevent you associating with them. And anyone can have mental illness. My friend was telling me the other day that, Ruki, honestly, most Nigerians have mental health illness, one form or the other. I'm tending to agree because it's pretty obvious that we're not really looking at things as we should, starting from the government and talking from our leaders, our legislators, our executives. All of them, many people use things like alcohol and street drugs, even marijuana, to calm their nerves. And that's not the way to treat mental health illness. So for me, we have, going back to the drawing board, is still government. We have lots of primary healthcare centers. We have lots of secondary healthcare centers. I'm talking government built. How are they being utilized to help people? Where's the access to healthcare? Where's the access to mental health care? In this particular pandemic, I would like to see the government do more to put money in the pockets of people. Find out how are they doing. Not just talking about stay at home, go and get your NIN and all that. Just ask, how are you really doing? What can we do to help you? How can we distribute things to you safely?
Dr. Ugwumba, in the just about 2 minutes that we have left for this conversation, what would you suggest to individuals how to survive as coping mechanisms, since you brought up the issue of mental health, coping mechanisms in the face of distress arising from COVID-19, stress down, do this, don't do that, and will you consider the general response of the Nigerian populace an indication of a collective mental crisis? Because each time government says these are the guidelines, the very same day you will see the people deliberately violating those guidelines. The day the governor of Lagos State shut down clubs and bars, that same day some clubs opened and they were filled up. Is that in itself a sign of madness?
You could say so, but in general, people are hurting. And when you're telling people to isolate, Nigerians are very sociable people. So we just have to teach them how to associate safely. The truth is, if you have someone to talk to, if you see someone, a friendly face, you may not want to kill yourself. If you see someone who actually cares for you, you may not want to do that. Now, our churches are very, I would just call it notorious for giving hope to people. And at the same time, now we can't allow them to go there. So yes, it's a very difficult time. Everyone is hurting, especially financially. How are we going to cope with it? We have to let you know that the virtual means of associating until you can do things normally again. So I would say everything in moderation. Tighten your purse so that you don't have more financial strain on yourself. Exercise, physical exercise is critical for brain food. It puts oxygen in your brain and releases dopamine and some good hormones that make you feel alive. So physical exercise, if you're not a runner, start running. If you don't like to run, dance to some nice music, you know? And then actually pray. Actually, they say there are three things: eat, love, and pray. Those three things are always very helpful to help your mindfulness.
Thank you very much, Doctor. On that note, we would like to thank you very much for joining us on the Morning Show.